Hi, my name's Amelia, and today I'll be presenting on the benefits of ashwagandha root for older adults. So, first off, what have we heard about ashwagandha? So, it's basically the stereotype around it is that it is like a magic fix for stress, anxiety, sleep, and boosting energy, and even helping people with low testosterone. And it kind of gained popularity last year on TikTok and reels and stuff by herbalists and gym bros and a lot of self-help influencers. So I kind of wanted to deep dive into what it actually is. So what is ashwagandha? Basically, it is a root extracted from an herb from the nightshade family, and its proper scientific name is the Withania somnifera eldana. It's might be hard to say, but it is a tradition practiced in Ayurvedic medicine in India, which has actually been used as far back as 6000 BC. So, the chemical properties is that it contains several bioactive compounds, including a group of substances known as withanolides, which basically is associated with anti-inflammatory and antioxidant effects. So yeah, I chose this because previous research suggests that ashwagandha root extract can improve, again, gaining better sleep quality, increased daily energy, reducing stress and anxiety, and increasing cognitive function, also reducing inflammation and joint health, and increasing better hormonal regulation and libido, and in some cases, testosterone. So, in this presentation, I will mostly focus on research regarding sleep and also cognitive function and joint pain because I felt like those were the most important topics for older adults. So here's my first news article is how accurate are the claims about the benefits of ashwagandha. So in this first article, the findings were that ashwagandha does in fact reduce cortisol, which lowers stress, and it also can protect against neurodegenerative diseases like Alzheimer's. Another finding was that mild effects on testosterone and libido and muscle strength, so not as big of findings as the other ones. However, it did find that some negative effects were gastrointestinal upset, drowsiness, and liver toxicity, but this is at really high doses, so we'll get into that further. So looking further, so basically this last slide was a review article, and so what I did was I looked through those individual articles that they reviewed, and this was one of them. So this is specifically on elderly adults. So this is titled Efficacy and Tolerability of Ashwagandha Root Extract in the Elderly for Improvement of General Well-Being and Sleep, which was a prospective, randomized, double-blind, placebo-controlled study. So this is more important to our class discussions. So the findings of this study, the objective, again, was to assess safety, efficacy, and tolerability of ashwagandha root extract on the improvement mainly for general health and sleep in elderly people. And the way that they did it was a 12-week prospective, randomized, double-blind, placebo-controlled study. So basically what they did is they took 25 people and they gave them 600 milligrams of this extract a day, and then they gave the other half, the other 25 of the study, just a placebo group. So again, the groups did not know which dosage they were assigned, if they did have the root extract or if they just had the placebo. So it was double blind. And so looking at the results, there was actually a significant increase in the quality of sleep and mental alertness for the ashwagandha treatment group compared to the placebo group, which supports the objective. So in conclusion for this first finding is that overall improvement was observed for the general well-being and the other effects for the older adults, which is really good. And so the next study that I looked at was increasing cognitive function specifically in patients with diseases by using ashwagandha. So this study was a meta-analysis that looked at ashwagandha extract and how it improved performance on cognitive tasks, executive function, attention, and reaction time. And these are really important factors when you're looking at helping someone who might be diagnosed with Alzheimer's disease or even different types of dementia. So, their findings from this study was that the ashwagandha extract inhibits the cyclogenesis. Sorry, this is complicated, too. But it reduced, basically, what it means is that it reduced inflammation by lowering the acute phase reactants and suppressing this specific type of macroglobulin, which lowers like the stress built up in the brain, is what that basically means. And they also found in this study that it increased brain derived neurotropic factor. And basically, what that means is it protects the brain cells from damage. So it helps the brain cells survive. So these are all really important, not just for maintaining overall health, but they could even potentially be preventative measures. So if you see someone with like early onset of these diseases, it might actually help prevent against that by helping this increase in brain-derived neurotropic factor, which is really important. And so then, my next study that I looked at specifically joint pain and arthritis. So, one study found that ashwagandha eased arthritis-related symptoms, including pain and joint swelling, specifically in people with rheumatoid arthritis. And since this is an autoimmune disease, it's really important that this could be used for future findings because it's hard to treat people with this, especially before it's being caught. So one of the findings was that this could also be a preventative method if they take this early onset. And so another study showed that ashwagandha had anti-inflammatory effects on human cartilage cells with osteoarthritis. And again, this is also really useful when we talk in class about all the hip replacements from people who have developed osteoarthritis. This is really important in preventing that and also potentially just easing pain. And a third study found that it helped adults with general knee and joint pain and discomfort in patients who were undiagnosed with autoimmune diseases concerning mild pain. So just older adults who they might not actually have arthritis or, osteoarthritis, but they might just feel joint pain upon waking or in other daily activities. And they did find that patients who took them, regardless of their diagnosis, did find improvement. And so I just put a little note at the bottom here that it's also important to note that this study did find a couple adverse effects, such as like loose stool and low blood sugar. But this is only if you take like over 1,000 milligrams, so shouldn't be enough to worry about because most of these studies focused on 600 milligrams daily. And so, how this relates to class, cognitive decline is a major issue for older adults that presents as memory loss, low attention and focus, visuospatial skills, and also the inability to dual task, as we learned in our hands-on practical stuff. And ashwagandha shows positive trends for increasing mental alertness, focus, and memory in older adults, which is like really amazing, honestly. And also, another thing is that getting restful sleep and maintaining high energy are very important for older adults to combat these adverse health effects. And ashwagandha supplementation also proves it's important in reducing stress and promoting restful sleep and more energy upon waking, which who doesn't want more energy? So that's nice. And then basically, in conclusion, ashwagandha could be a really helpful natural remedy for improving overall health of older adults, specifically by increasing a good night's sleep, reducing stress, increasing day-to-day energy, and also reducing joint inflammation, which is yay. And so also, more research definitely needs to be done on more diverse populations, such as studies specifically completed on dementia patients instead of just Alzheimer's patients. So, that could be really useful. And although ashwagandha has been in the use for thousands of years and research shows it is useful, we cannot expect it to be a miracle drug like some people on social media promote it to be, and it affects people in different ways. So, it's always good to remember. And thank you. Here are my sources.